Hello everyone. So today we will discuss how the clinical questions are formed on age estimation by mixing the dentition and the radiographs. Okay. Now, question number first. Determine the age of the female. So you have to first note that it is a female because you have to remember that the joints and the bones they fuse 1 year earlier in female as compared to males. Okay. Now, the dental status of the female is as follows. Total 28 teeth in number that are all are permanent. Okay. And space behind second molar is present. So that means that the age is greater than 14 years because after 14 years there are no temporary teeth in the oral cavity and they all are permanent, and also the space behind second molar is present, which means the third molar has not appeared. Third molar appears at the age of 17 to 25 years. So the age of this female is between 14 to 17 years according to dentition. Okay. Now another point is the X-ray of various joints. Now we have to look at the X-rays of various joints. First, the shoulder joint epiphysis of humerus is not fused. The epiphysis of humerus it fuses at the age of 18 to 19 years in males, but this is a female, so it will fuse at the age of 17 to 18 years. So it is not fused. The girl is less than of 17 years of age. Second X-ray, elbow joint. All epiphyses are fused. The epiphysis fuses at the age of elbow joint at the age of 16 years. So the girl is greater than 16 years. Third point, wrist joint. The base of first metacarpal is fused. It fuses at the age of 15 years. And the lower end of radius and ulna, they are not fused. They fuses at the age of 18 to 19 years in males. But in female, it will fuse at the age of 17 to 18 years. And same it can be said for the knee joint. Now, the hip joint, the iliac crest and ischial tuberosity, they are appeared. Iliac crest, it appears at the age of 14 year, and ischial tuberosity, it appears at the age of 16 year. So they are appeared. So the female is greater than 16 years of age, but they are not fused. So that means they are less than uh, 19 to 20 years because in females they fuses at the age of 19 to 20 years. So what is the answer? The answer is 16 to 17 years of age. Question number 2. Determine the age of the male. So here is the subject is male. Okay. His dental status is as follows. 24 teeth in number, out of which only 4 are temporary and the rest are permanent. Okay. 4 are temporary and the rest are permanent. That means the child is of mixed dentition age, which is 7 to 12 years. Okay. But there are only 4 temporary teeth left, which are canines. So the child is greater than 9 or 10 years. Okay. X-ray findings are as follows. First, the X-ray of elbow joint. What does X-ray of elbow joint shows? Medial epicondyle is not fused with the humerus bone. So medial epicondyle has appeared, but it has not fused. It fuses at the age of 14 years. Okay. The second finding is upper end of radius and ulna are not fused. So upper end of radius and ulna, that is elbow joint, it fuses at the age of 16 years. Now look at the X-ray of wrist joint. Wrist joint shows ossification center for pisiform bone. It has appeared. So it appears at the age of 10 to 11 years. So according to this, we can find that the child is less than age of 12 years but greater than age of 11 years. So the answer is, and also the first base of first metacarpal is not fused. It fuses at the age of 15 years. So the answer is 11 to 12 years. Okay. Now, the third question, determine the age of the female. So, the subject in this question is female. Now, the dental status of female is as 30 teeth. It means lower third molar fully erupted. So, this means the third molar has erupted, which means the female is greater than age of 17, but less than 25. Okay, because all third molar are not erupted. All third molar are not erupted. Okay. Now, X-ray status of the female is as follows. X-ray of shoulder joint. All epiphyses fuse. The shoulder joint in female, it fuses at the age of 17 to 18 years. X-ray of elbow joint. All epiphyses fused. It occurs at the age of 16 years. X-ray of wrist joint. All epiphyses fused. It occurs at the age of 17 to 18 years. X-ray of knee joint. It occurs at the age of 17 to 18 years. Now, the important point is that iliac crest and ischial tuberosity, they are appeared, but they are not fused. So, iliac crest, it appears at the age of 14 years, and ischial tuberosity, it appears at the age of 16 years. But in the males, it fuses at the age of 20 to 21 years, and in females, it will fuse at the age of 19 to 20 years. So, the age of the female is greater than 18 years and less than 20 years. So the answer is 19 to 20 years. Now, question number 4. Determine the age of the female. So here the subject is female. The dental status of the female are as follows. Total number of teeth 24, out of which 10 are temporary and 14 are permanent. So this is the period of mixed dentition. So the age of female is between 7 to 12 years, but there are 10 temporary and 14 permanent, so it may be greater than 8. Okay. Now X-ray status of the female are as follows. X-ray of right elbow joint. Medial epicondyle has appeared, but it has not fused with the humerus. So the medial epicondyle, it appears at the age of 6 to 7 years, but it fuses at the age of 14 years. So the child is greater than age of 6 years, which we have also determined by the total number of teeth. Now the second point is lateral condyle of humerus has not appeared. So the lateral condyle of humerus, it appears at the age of 11 years. Okay. So the child is less than age of 11 years but greater than age of 7 years. Now the another point is X-ray of right wrist joint. It shows that pisiform bone has not appeared. So pisiform bone, it appears at the age of 10 to 11 years. So the child is less than age of 10 years. Okay. So the total number of carpal bones in the wrist are 7. So according to this, we can determine the age of the female as 8 to 10 years.